Hi, I'm here with Parveen Muhammad Ali with the Ministry of Health Oman. Good day.
Thank you. It's my pleasure to be here.
Appreciate your time.
Thank you.
So I know the Ministry of Health has some initiatives that you are doing to improve diagnostic imaging for your population. Could you tell us about your initiatives?
Well, I am an advisor to the Committee of Radiology Technical Advisor for purchasing general radiography equipments. Oman is a large country, it's a large spread out population, and the vision of the ministry is to provide the best equipments to all over the regions, whether it's to a health center or a polyclinic or a big hospital. But the Ministry of Health reaches out to the whole population with providing the best of diagnostic equipment to provide lowest dose, good and fast patient workflow, therefore making it easier for the radiographers to do their work in the best of care of the patient.
Sounds very strategic and smart.
Yes.
Can you tell us, how do you go about choosing the technology for diagnostic imaging?
Well, for me, I make it my duty to study each and every vendor's technology for diagnostic general equipment. I study the physics part of it, the ergonomics part of the equipment, how easy it is to handle. And because in Oman we have a very young population that come for X-ray, it's a younger population, families are quite young, we have a lot of pediatrics. Therefore I choose that vendor that gives the least dose at the best exposure factors, and that gives the best support service, whether it is to service the equipment and also to train the radiographers to operate the equipment. So the support is important, the technology is important, and this is basically my advice to the ministry.
And do you provide any kind of training to staff so that they can make full use of the equipment that you choose?
Well, as far as I'm concerned, training is the most important thing. It's no use buying high-tech equipment and not receiving the right training. So I make very sure that the vendors that we purchase for provide several levels of training. We start training level 1, at which they are just taught on how to use the equipment, and then the advanced training, usually we get the vendors to bring radiographers who have the best knowledge on how to operate equipment. Recently, Carestream brought over a radiographer by the name of Martin, and we got all the radiographers who are using the Carestream equipment, and we ran a workshop, and Mr. Martin was able to answer all their questions, all their difficulties, and basically to educate them on the best practice to give the lowest dose, especially for pediatrics. It was very successful. And we do that with all vendors, even for mammography. We had the vendors bring in radiographers from the King's Hospital and teach us how to use the equipment for the best practice, so that mammography, is also a high dose practice. Therefore, training is important, and vendors are made to be a part of the training of the radiographers. It's a very crucial role.
I agree. Very interesting. Well, thank you for taking the time to come by, and we wish you and the ministry the best of luck.
I thank you for being here, and thank you for inviting me, and I am honored to represent my country. Honored. Thank you.
Thank you.
You.